When I was a new nurse, I felt like there was never enough time to do anything. I would be constantly running around like a chicken with my head cut off, trying to pass meds, do treatments, document, and what I ended up doing is sacrificing getting to know my patients and spending time with them. Well, over the years, I learned that it is much better to make your patients feel like you care and that they're in good hands than to have all your nurses' notes documented by lunchtime. So these are 4 things that I do so that I have excellent bedside manner, and I'm going to tell you so that you can have excellent bedside manner too. Number 1 is introduce yourself to your patient and shake their hand. Most nurses introduce themselves, but do they shake hands? No, not really. Patients remember when you do. Number 2 is offer water, juice, and coffee to everybody in the room, not just the patient. The family members are there and they're waiting, they're tired, they're thirsty. Let them know that you're going to be attentive to their needs, secondary to the patient, of course, but they remember things like that. Number 3 is apologize if you are late. If you got caught up with an admission, or if there was a fire, or if you saved a beached whale, it doesn't matter. When you come into that room, always start off by apologizing for being late. Let the patients know that you understand how frustrating it can be to wait when you really need care. The 4th thing is so important, and it saved me on so many occasions. I always overestimate my return, and that just means that if I have to leave out the room to do something that will only take me 5 minutes, I tell my patient I'll be back in 15 minutes. Because when I walk out of that patient's room, I never know what can hit me. Somebody might desperately need me. I might get a phone call from a doctor. So I give myself a cushion in order to just combat whatever comes ahead of me. And it doesn't always take me 15 minutes. Sometimes it really does take me 5 minutes. But if the patient is waiting for me and I come back sooner than he anticipated, well, then they're happy and they're surprised. And it makes me look like an efficient, effective nurse. Tip. It is sit down whenever possible. I know for new nurses, like the last thing you want to do is sit down, but if you can sit down and talk to your patient, or if you can sit down and jot a quick note, it will appear as if you're spending more time with the patient. It relaxes them, it relaxes you, and they think that you're a really great nurse because you're actually taking time to sit and chat with them. Now, this is not something that I was able to do right away, but after I got into my routine and I was very good with prioritizing my care, I was able to sit in my patient's room and write a note, or sit in my patient's room and look over my orders, and at the same time talk to them. So make that your goal, and I am sure they will be so appreciative of your excellent bedside manner.